As we've been saying, the Nurses Union is meeting the government today for intensive talks, and they've paused next month's strikes. Elsewhere, the British Medical Association is sitting down with health officials as well, but it's understood the Health Secretary, Steve Barclay, won't be at that meeting. Dr Emma Runswick is Deputy Chair of the BMA and is with us now. Hi, Doctor, it's good to see you. So are nurses being given preferential treatment?
I'm not sure that they are, because at the same time as they have announced intensive talks with the RCN, they have also submitted their evidence to the pay review bodies, suggesting that many public sector workers, including doctors, including nurses, should receive only 3.5% in next year's pay round, which is not only another real terms pay cut of over 6%, but also makes absolutely no effort to address the real terms pay cuts that we've had over the last decade or more. And for doctors, that's a real terms pay cut of over a quarter, 26% for junior doctors and about 30% for consultants. Nurses are in a slightly different position, but I'm hoping that talks today with RCN and with BMA will produce an offer that is substantially better than that and is less of an insult.
OK, but nurses are being called in for the 21st century equivalent of beer and sandwiches. You guys have not got talks with the Health Secretary, have you?
Not today. That's very unfortunate. And we had hoped that the Health Secretary would come to the meeting today with the Department of Health and Social Care. But those are questions that you have to ask him, really, about whether this is important enough. Is it important for him to avoid 72 hours of strike action by junior doctors in March? And if it is, then there needs to be a significant change in the approach.
I suppose that's why I'm asking you whether nurses are getting preferential treatment, divide and conquer.
Yeah, I don't think they are, because as we've seen, at the same time as they're offering talks, they are also saying that nurses should receive another real terms pay cut this year. So I don't think that looks like especially preferential treatment. I think it looks like a tactic to delay strike action. And it's the same that they've done to nurses, to teachers even. They've offered the teachers talks, again, on the condition of cancelled strike action, whilst simultaneously saying that they deserve another real terms pay cut in the next pay round. So I don't think that represents a serious set of offers or a serious set of talks. I think that that's insulting to doctors, nurses and all other public sector workers.
Should it be the Health Secretary who's having these conversations with you, or do you want the Prime Minister to get involved now?
I think it would be perfectly reasonable for the Prime Minister and indeed the Chancellor to get involved with talks. The Department of Health and Social Care are telling us that there's no additional money, and therefore the decision makers are the Chancellor and the Prime Minister. The NHS is in a complete crisis, workforce crisis, waiting list crisis, staffing crisis. We could do better than this, and if the Prime Minister and Chancellor are serious about that, then they will support the Department of Health to give us serious offers on pay.
OK, good to talk to you. Thank you.
Thank you very much.